Welcome to the Amplified Podcast Reloaded. Groundwork Ohio is a committed, nonpartisan public policy, research, and advocacy organization where we focus on the time when children's experiences and environments most influence their health development and life trajectory from birth to age 5. Our vision? That Ohio is the best place to be a young child, and every child has the opportunity to reach their full potential. Greetings and welcome to another episode of the Amplified Podcast Reloaded. My name is Vanessa Butler, and I have the pleasure of serving as Groundwork Ohio Senior Director of Community Relations. And today we'll be talking to a few of my partners in good here at Groundwork. Caitlin Feldman, our Senior Director of Policy, as well as Dominique Johnson, one of our policy associates. Caitlin Feldman serves as our Senior Director of Policy, where she leads the organization's strategic advancement of policy priorities in maternal and young child health and early childhood trauma prevention. During her tenure, she has led the expansion of Groundwork's influence in health and mental health policy advocacy for Ohio's youngest children and families, deepened the organization's leadership in infant and early childhood mental health policy, and worked to steward the Safe Babies program to improve Ohio's infant toddler court teams. Her policy and advocacy expertise is rooted in years of direct patient care and mental health program management. As a practitioner, she specialized in treating grief, loss, and trauma for individuals ages 3 and up. In her work as a grief practitioner, educator, and program administrator, she was dedicated to expanding access to emotional and mental health support services, particularly for those in impoverished and rural communities across the country. Dominique Johnson is a passionate advocate for maternal and child health with a focus on addressing disparities in underserved communities. As a board member of Queens Village, a minority women-led organization, Dominique has been at the forefront of efforts to reduce infant mortality rates in African American communities. Her work involves collaborating with healthcare professionals, legislators, and community leaders to advocate for policy changes, promote health equity, and implement programs that empower families. She has partnered with Nationwide Children's Hospital on safe sleep initiatives, working to help with the reduction of infant sleep-related deaths in Columbus, Ohio. Her commitment to bridging gaps between communities and health organizations is informed by her own experiences as a mother. Her perspective, combined with her professional expertise, allows her to identify the challenges families face while advancing innovative solutions to improve health outcomes. Caitlin and Dominique, welcome.
Thank you for
I know that it's always important to lay the foundation and a part of what brings you to Groundwork in terms of your purpose work. So one of the first questions that we always love to ask guests is, what is your why, and what was the moment you decided to become a champion in this space?
Okay, I'll start then. Well, when we speak specifically about like the Safe Babies work, I had never really heard of Safe Babies before, but after starting to work here and learning about the Safe Babies work from Caitlin and also reading a lot about what they had done in the court systems, I saw the importance of the work. But it wasn't until I was able to hear from parent leaders who had been through the child welfare system, and they spoke about just needing a little help or someone to see them and believe in them. Those stories taught me that we are all just one person loving us, believing in us, helping us away from the other side of things. So since I was blessed to be on the side of love and family, I wanted to help in a way, any way that I could to help those on the other side.
Mm.
Yes, so my background is in mental health. I do have a mental health license. I came from the hospice side of things, end of life. And so it's somewhat of a non-traditional path that led me to early childhood advocacy. But I like to say that um, working with primarily older adults at the end of life, there's a real there's a real tangible element to being able to see where folks end up in the final days of life. Hospice is really rooted in comfort care and dignity and autonomy.
Hmm.
And when you're going into different spaces, I mean, it's just sometimes night and day going into some assisted living facilities or some homes, for example, where there's a lot of comforts and security and really high quality care. And then that's compared to other places where families are stretched thin. They're trying to do it all in the home with very little support, and they're unable to afford like round the clock caregivers like they might need. And so that really motivated me to think differently and think bigger. Hospice is a free service through Medicare. We talk a lot about Medicaid here, but through Medicare, hospice is a free service. And so, why does the hospice experience look so different for some people versus other people?
Hmm.
And now here in my role at Groundwork Ohio, it's really motivating to me to be able to work on these policy issues and financing opportunities that support strong outcomes for people from the very earliest days of life, from the very first moment that they're known in their mother's womb. And all of those policies and programs and practices that we can have established early in life helps to set the stage for a lifetime of positive outcomes up to and including the end of life. So that's really what brings me to Groundwork. And the really unique thing about the Safe Babies approach is its intersection with systems, both like state and local systems, as well as the family facing work. And all of that is kind of combined into one really unique approach.
Yeah. Thank you so much for teeing up the crux of our conversation around the Safe Babies Court team and the approach as you just gently outlined or set the stage for. So for those who may be new to this work, Caitlin, can you explain what this initiative and approach is and why it matters for Ohio's youngest children and families?
Yes. So it's really rooted in bringing a more holistic and trauma informed and strength based and family centered approach to the child welfare system, specifically for families with very young children who are involved in that system. I've seen some really powerful things in courtroom settings, which is where this program started in Ohio, and to where we are now, which I'm sure we'll get into a little bit later, that's really focused on preventing that deeper child welfare system involvement. So there's a lot of different ways that we are intervening and thinking outside the box and trying to support these families in a way that's directly responsive to what their needs are. And that looks different in every community where this program is functioning. So we have 3 active sites. There's one serving Lucas County, which is the Toledo area. We have Cuyahoga County serving the Cleveland area, Scioto County serving the Portsmouth area. Those 3 communities were selected initially based on geographic diversity. We have an urban community, a suburban community, and a rural community. So both because of that reason, but also because the needs in those areas are distinct. They have different aspects of the child welfare system and why families are interacting with that system. There are different reasons that families are interfacing with those children's protective service agencies, with the court systems locally. For example, in Scioto County, they have among the highest number of infants removed at birth due to substance use exposure in the womb. So a mother will give birth and the child is removed automatically. It sort of triggers this chain reaction where there is, it's indicated in some sort of test that there's been an exposure and the child is removed at birth. And so we are taking challenges like that, just to use that as an example, and saying, okay, well, sure, there are things that we can do in the child welfare system, in the juvenile court system, working with judges, educating attorneys so that they can be better informed as to how to really support families being successful in being reunited with their children, to really support the best possible outcome for the child. There are ways we can do that, but then there might also be these other ways where we can support a family who is struggling with substance abuse, again, using that same example, before the birth happens, before that child is removed in the
Mm.
hospital. So how can we work with community partners to build a system of care where the parent is identified as having this need and then, sort of channeled to the resources locally that can best support her needs. So in Scioto County, we have a unique relationship with a residential treatment program where mom and baby can live together. It's a
Mhm.
method by which the baby would not be removed from the mother's care, but instead would be in the context of this safe environment where the mom can receive treatment support,
Sure.
education to support positive outcomes for the baby, and
Absolutely.
again, prevent that deeper systems involvement.
No, that was really, really in depth. I think what folks would also be curious about, being that early childhood trauma prevention is one of Groundwork Ohio's core pillars of work, how did we become engaged in supporting this effort?
Yes. So I mentioned that there's this element of the family facing work and
Yes.
then the systems building work that's a part of that. So Groundwork Ohio does not lead this work alone. I think it's important to note that we have a statewide collective of partners that are supporting this work. And Groundwork is just one of the legs of the
Mhm.
table, so to speak, that's upholding and building out this work. And
Yes.
the reason that we were brought to the table is because of our policy and advocacy expertise. That support that we can provide, coupled with the knowledge that we gain from the local communities that are serving the families, it offers a really strong feedback loop to ensure that what we are advocating for at the state level is responsive to the actual lived needs of the families, but then also is identifying where gaps and opportunities exist in those local community systems as well. So I want to touch also on what you said, Vanessa, about early childhood trauma.
Sure.
And I think one really excellent example of how Groundwork Ohio is supporting this work, we don't do any direct practice work with families.
Right.
We are not the ones picking up the phone and talking with families, but we are providing support, resources, education that helps to benefit the systems that are supporting these families. So one way we do that is through our infant and early childhood mental health advocacy work. This is something that was new to me when I joined the Groundwork Ohio team. Although I had this background in mental health, it's just not talked about very much. I think a
Mhm.
lot of folks are kind of surprised to hear that infants and young children actually do have mental health needs.
That's right.
This can include things as formal as post traumatic stress disorder diagnosis, anxiety diagnosis. It shows up in different ways in infants. So, we do a lot of work with local practitioners around the state to understand how early childhood trauma is showing up and how our systems can better respond to the needs. What are the gaps and what are the needs? One thing that we've really found is that there is a pretty substantial need for families to be connected with infant early childhood mental health resources that's rooted in building strong relationships between the child and the parent, really supporting strong attachment there early in life that serves their relationships down the line, helps them to be ready to enter kindergarten, ready to learn when those relationships feel solid and stable, when they feel nurtured.
Mm.
So all of that creates a picture for a healthy mental health picture for a young child. And the things that we can do from a systems level is to make sure that those children and families that have those needs have access to the right resources. Not everybody needs mental health treatment the way that we think about it. Some families do benefit from those kind of interventions, but other families might benefit from education. How do I respond when my baby is crying and I'm getting stressed out? How do I regulate my emotions so that I can show up correctly for my baby?
That's so true.
And so our work is really rooted in listening to the providers and then working with.
Think Caitlin has so eloquently outlined is just how much this work requires deep collaboration, intentional collaboration. So including the court systems, including child welfare experts, health and community partners. What does successful collaboration look and feel like for those that would be interested in doing some sort of collaborative work for a community need?
Is actually seeing families and working with families.
Okay.
As we started to, like she said, moved on to more of a prevention work. Now that we have moved to that, those collaborations and partnerships have become even more important than they were before because these community coordinators and family leaders are now working alongside the family while the kids are still in the family. So they have to walk beside them in there with their children. And then they finding out that these are having even different um, needs and different needs for collaboration and partnerships, from everything from basic needs like food programs or housing and rental assistance to more in-depth collaboration when we talk about the mental health support and substance abuse programs, and also trying to build a system level change still with those court systems and child welfare, because even though we're focused on prevention, some of these families might still have to see the court system.
That's right.
So it's important to build these successful collaborations and partnerships so that we can lean on all the things that a family need in partnership to succeed. So it's really looking outside of just the court system and the legal system into the basic needs of families and children around the state of Ohio, and specifically in Cuyahoga County.
What are some potential challenges in aligning so many partners? You hear the adage, too many cooks in the kitchen, but these are necessary individuals and experts that are currently sitting at the table. But I think, are there any challenges that comes along with that? And how do you Mhm.
Because every family is different, their needs are different, and then the programs that they're looking for have different qualifications and timelines. A family might need something right now, and the program that are there to support them in that community might take weeks or months to be able to get through. So it was important in Cuyahoga County, where they were seeing families, for them to have a system, and they were able to collect information on all the programs in that area and what their qualifications were, so that when the family comes with these needs, they're able to look back at their database and say, okay, well, this family matches with this need and that family might match with that need. And then sometimes none of these programs that they have or in their database will work for that family. So now we have to think creatively about finding new partners. So it's important to have a data. They were able to create that database, but also be open to the fact that these partnerships might not work when a family comes with needs outside of what those partners can give them, and to be creative. And if they've become real creative, found ways to just build new partnerships constantly and constantly. So it's never ending. They're always needed for more cooks in the kitchen.
I'm curious about any success stories that you guys have become privy to, either out of Lucas or Scioto or Cuyahoga counties.
Yes, we've seen recently that we had our very first family graduate from the Safe Babies program
Wow.
in Cuyahoga County,
Wow.
where, as Dominique mentioned, they're actively serving families. I think they currently have 8 additional families they're serving. And this prevention focused work just started in January of 2025.
Yeah.
And it is now September. And in that time frame, they have successfully graduated one family that was able to remain intact and did not experience the foster care system because of the efforts of the community coordinators and the local community efforts that wrapped around this family, and specifically drilled down to provide support on the family's actual needs to help prevent that deeper systems involvement. Here still, it's really important to us to be able to tell the story to our funder for how we're doing this. And our funder is actually HRSA through HHS. So it is a federal funder that we're accountable to say, they're very supportive of our prevention focused work. And they're also very curious how we go about measuring success and how we are able to really quantify that. Because there's, it's one thing to say the number of days in foster care versus prevented foster care entry. Well, what are the true outcomes that we are supporting. And so we're so thrilled that we were able to support that family and to be able to learn from that experience and help it to spread to the other families we're working with. We selected a survey that is essentially like a pre and post test survey. This is where we're starting, and there's opportunities to grow from here. But between the pre-test and the post-test survey, the family indicated that the things that were within the control of the Safe Babies program, such as trusting relationships with providers, the outcomes between the pre and post-test survey were just through the roof, like a huge increase in their trust for the folks that are working within these systems and aiming to make the systems better, to make the systems more responsive to family needs rather than the business as usual approach.
That's right.
So that is just one example. But as Dominique said, we are also really interested and really passionate about maintaining our connections with the folks that are doing the court-based work as well, so that if there is a time when a family does become more deeply involved in the child welfare system, there's an opportunity for warm handoffs, for collaboration.
That's right.
And to just maintain that that atmosphere of support kind of across sectors. And there's just such a strong history in the Safe Babies program of having really transformative practices in the court-based setting. And this is something that I had the privilege of witnessing firsthand, going to court hearings under the initial iteration of the program where we were serving families that had that were in the foster care system, that had been working with a judge. Being in those courtrooms was just a completely different experience than you would think. You know, going into a courtroom can feel stuffy, intimidating, scary, especially when there's a lot riding on it. Like you're trying to be reunited with your child. You're trying to work the steps you've been given. And in a Safe Babies courtroom, there would be toys in the corner and the young children would be encouraged to be there. The foster family would be encouraged to be there if they would like to be. There were opportunities for the family to interface and to interact with the child. The judge provided a supportive atmosphere for that and really encouraged that bonding between the child and the parent when they were in the courtroom, and just went out of their way to be as approachable, as respectful, and again, as strength-based as they possibly could when working with families.
Wow. I can't even imagine what impact that left on you. Did this happen earlier on, like when you first joined Groundwork and you were able to see this firsthand?
Yes. So I joined Groundwork in the summer of 2023, and I think it was within that first maybe 6 months of my tenure here to be able to go to those local communities and see their process in person was really powerful.
I can't even imagine. On the national funder, HRSA, can you share a little bit more about the national model from 0 to 3 and how Ohio tailors to meet Ohio's unique needs?
Yes. So thank you so much. Okay. So this is really interesting to me. So Safe Babies is considered an approach versus a model. We are taking something cookie cutter, like copy paste. There is this national approach, the Safe Babies approach, that was designed by 0 to 3 in the 1990s. They were the first to identify the child welfare experience as it currently stands is not responsive to the developmental needs of young children. Young children, infants, toddlers are more likely to have more foster home placements. They're more likely to be moved more frequently, which disrupts their attachment, creates instability. They don't know who is their primary caregiver, who to go to, who's going to meet their needs. And the concept previously, before this awareness, this greater awareness of infant and early childhood mental health, the thought was a baby's not going to remember, so they can be moved around. And, 0 to 3 with their expertise and being really like the gold standard in early childhood advocacy, they said that's not working. And we need to really build up a program and approach that does things differently. So it really is rooted in this concept of wanting to transform the child welfare experience for infants, toddlers, and families. So that national model, there were some states that were adopting these programs, and really it might not even be states, but local communities that were saying, we love this idea, we want to do something like that. It took a lot of buy-in from judicial leaders, from a judge to say, yes, I do want to run my courtroom differently.
That's
and as
right.
you can imagine, Not everyone feels that way. As human beings, we don't always love change. And so, 0 to 3 started by saying, here's the data, here are what our concerns are and how we can do things differently. And starting early by telling that evidence and impact story, like here is how we are reducing wait lists for families. Here is how we are supporting reunification rates. Here's how families are doing when we do things differently. So they started those conversations again in the 1990s. It was just, I want to say it was 2020 when HRSA really caught wind of this and said, we want to fund this. Essentially, like, this is a really exciting pilot. We want to learn from the work that you're doing
Sure.
and support better outcomes for kids in the foster care system and within the child welfare system. So they became a funder, and there were 12 states that were selected as statewide expansion sites. Ohio being one. So we got in early in 2020 and started having these conversations and putting the building blocks together, essentially. Again, thinking about, well, which communities makes the most sense for us to add this kind of pilot project, and how are we going to structure it, and who are the partners that need to be at the table, and building these essentially local coalitions to
Sure.
support and uphold the work. And then the next stages of like planning how we're going to intervene with families, what judges are going to carry this work, what education do we need to be provided to the attorneys, but also to child welfare caseworkers and providers and others about why it's important to do things differently. So all of that to say, we had some really great success with the initial iteration of the program. And going back to what I shared earlier about it takes a leader, essentially a champion, and under the previous iteration of the program, a judicial champion specifically to uphold the work. And when there are changes in local judicial leadership, the new judge coming in doesn't necessarily have the same priorities as the previous judge, and they have concerns in their community that they want to address when they now hold that position of power. And so sort of within a year, really, there were a few different things that happened that caused us to have to say, okay, we have the support from HRSA, we have the support from the community, we have all these other folks that are really bought in. Is it really true that we can only have this impact in the court system and through a judge? We don't think so. So then we started on this really intentional path of going back to the drawing board, thinking differently, talking with HRSA, talking with 0 to 3, and thinking about that prevention focus that Dominique really exemplified really well. And now Ohio's in this really unique place where 0 to 3 and BRSA is actually learning from Ohio. They're learning from the work that we are doing to take lessons from that and to identify what the future of the Safe Babies approach is going to look like, because Ohio truly isn't unique in that the local judicial leader change is really driving how the work is being disseminated in the community. That's not specific to Toledo, Ohio. That's
right.
happening in a lot of other states that are bringing the Safe Babies approach to their child welfare program. So we have this fantastic opportunity to share our learnings, our lessons learned, the things that have worked, the things that maybe didn't work so well, to inform and influence folks all over the country.
That's amazing. And that's an amazing segue to the next question for Dominique. But what I want to call out is you distinguishing approach versus model. And so what that allows is for more co-creation. It allows for more collaboration and a more community-based perspective because you're remaining nimble. Like you just have like a very nice template and you say, hey, how can we formulate this to best suit this particular community? So thank you for that distinguishment. Dominique, what is next for Safe Babies Courts teams in Ohio in terms of its growth and impact?
Oh, so the sky's the limit. Like I said, Cuyahoga currently seeing families, and we're looking to start seeing families in Scioto County very soon. And like she said, Scioto County is unique because a lot of their child welfare cases come at very, very, very early in a parenting journey when kids are being born. So in Scioto County, they're looking at getting referrals from the healthcare system. So that's hospital systems. So that means that we're able to get in when women are still pregnant with their babies or just delivering, to be able to stop those cases of being taken away very, very, very early. So we're very excited to see about the new challenges that might come with that, but also the new impact we can make on a family's life if they never get their children removed, or we get them maybe substance abuse while they're pregnant. So we're really excited about that. And also, like you said, HRSA grant, the grant was to look at 5 sites.
Yes.
And we had the 3 that we're focusing on, but we're also looking at expanding to another 2 sites. So we're looking at trying to do something maybe in Franklin County. We're still, working that out, but that's looking at something that we might be able to do very soon, and maybe in a healthcare system too. But also, we're still open to maybe even doing a court based system again, even though we're focused on prevention and Ohio is kind of leading the way in prevention. We haven't closed the door on court-based safe babies. So we're looking at maybe trying to figure out if we can do that somewhere in Ohio too, to still do that traditional court-based safe babies.
If you could encapsulize everything you just said and you take it to policymakers or community leaders, what is one action that you would implore them to take?
I would give them 1,000,000, but if I can only do one, it would be to listen to families, because a lot of times it's not that parents don't want to be good parents or that they're bad people. It's just that they don't have the resources, whether it be mental health support or basic needs like transportation to get to the job, to be able to afford the food and the housing that the children may need. So instead of creating policies and making people kind of live up to those policies, sometimes it's important to talk to the family, create the policies around what the family say that they need.
That's so good.
Mhm.
Thank you for that grounding. Thank you both for joining today. He's shared so much richness, and I know that people will be able to take so much wealth of knowledge from this episode. I'm curious to hear from the both of you. If you could describe a scene from your vision of the future for Ohio's youngest children and their caregivers, what would it look like and what would it feel like?
Well, Dominique said it so well. It always comes back to the families. That is why we do this work. We do it from this statewide level with that statewide lens, but it's all about the families. And so I can't describe a scene because I am not a good storyteller, but I can tell you what motivates me is the concept, the idea. Like my vision would be that a family comes to the professional that is in a position to help them, whether it's a caseworker, a provider of some kind, with their needs in tow, that they don't feel that they have to hide anything for fear of retribution, that a family can
Yes.
bring their full and complete self and feel comfortable, confident, trust the person that they're talking to understand that their needs are not an individual fault or an individual failing, and that no families would fall through the cracks in our system. Essentially, that our systems wouldn't have cracks at all, and that we would
Yes.
have this through line where family appears with their needs. They can, person that they're interacting with, the caseworker, provider, whoever, says, I know exactly how to help you get from point A to point B so
That's
that your
good.
needs can be met.
That's so good, Caitlin. What about you, Dominique?
Someone gets pregnant, that there's a community around them, a community of people to uplift them and to teach them and show them the way of being a parent. A lot of times we just somebody has a baby and you kind of just leave them with the baby to figure it all out. I would love to see a place where there was a community around everyone who had a child, to be able to help them to basic needs, to just support them mentally, physically, whatever they needed, so that that child can grow up in a loving environment.
Thank you both again for joining us today on Amplified Podcast Reloaded. Please remember, if you care for or love a young child in Ohio, you are an expert and your voice matters. Amplify your voice by sharing your own story, supporting others and sharing their stories, and advocate for changes that will support families and young children in your communities. Please rate, review, and subscribe to the Amplified Podcast Reloaded on the Groundwork YouTube channel. If you wish to engage with Groundwork Ohio to amplify your voice and support policies to improve the lives of Ohio's youngest children, please visit www.groundworkohio.org. Until next time.